Heat may feel like just another summer day to us, but for animals, especially livestock, excessive heat can become life-threatening. Today, we'll talk about hyperthermia, also known as heat stroke, a dangerous rise in body temperature that can turn deadly if ignored. Hyperthermia refers to the abnormal elevation of core body temperature due to excessive heat production or poor heat loss. Unlike fever, which is a controlled response to infection triggered by the hypothalamus, hyperthermia is caused by environmental heat or internal metabolic overload. This condition affects many species but is particularly serious in farm animals and exotic breeds during hot, humid weather. Etiology: animals exposed to high environmental temperatures and high humidity, over 60%, face increased risk because their ability to lose heat through sweating or panting is reduced. Dehydration, electrolyte imbalance, prolonged muscular activity, and poor ventilation worsen the situation. Exotic animals or those with thick hair coats are especially vulnerable. Animals with previous illnesses like foot and mouth disease, FMD, which can damage the hypothalamus, the brain's temperature-regulating center. Even toxin exposure can trigger or worsen hyperthermia during summer. Pathogenesis progresses through 3 stages. In the first stage, adaptive phase, the body tries to lose excess heat. Peripheral vasodilation, increased sweating, and rapid breathing help cool the blood. If heat continues to rise, the second stage kicks in, with signs of excitement, muscle tremors, increased heart rate, and respiratory effort, along with toxic buildup of nitrogenous wastes. Without interference, the body enters the third and critical stage. Here, vital functions decline, respiration becomes shallow, blood pressure drops, and the animal can go into shock, coma, and eventually death due to respiratory or cardiovascular failure. Clinical signs of hyperthermia include a sudden temperature spike. The rectal temperature is increased by 4 to 7 degrees Fahrenheit above normal, increased respiratory and heart rates, intense thirst, absence of urination and sweating, and lethargy or collapse. In severe cases, the animal may show convulsions, muscle spasms, or coma. The skin and mucous membranes may feel dry and hot, and signs of dehydration are obvious. Treatment needs to be urgent and supportive. Start by moving the animal to a shaded, well-ventilated area. Cold water or ice blocks can be applied to the body or given to lick. Intravenous fluids like 0.9% normal saline help rehydrate and stabilize circulation. Oxygen may be administered if available. In critical cases, anti-inflammatory steroids are used to reduce brain swelling and prevent shock. For example, dexamethasone can be given at 0.04 to 0.1 mg per kg in large animals and 0.1 to 0.2 mg per kg in small animals, depending on the case. Alternatives include prednisolone, sodium succinate, and methylprednisolone. A practical oral electrolyte solution is obtained by dissolving 20 g of table salt, NaCl, and 20 g of light salt, NaCl and KCl, in 5 liters of water, can be administered to an adult horse each hour by nasogastric tube. Prevention is better than cure. During hot seasons, ensure proper ventilation, provide unlimited access to clean water, avoid overcrowding, and reduce transportation or excessive exercise during peak heat hours. Monitor exotic or weak animals closely, especially after FMD or illness. So remember, heat stroke kills silently. Recognize early signs, act fast, and always create a heat-safe environment for your animals. Stay alert and protect your herd with VetCare.